We're still encouraging people to self-test and self-isolate, but in terms of tracking and monitoring that, all hospital admissions are tested for COVID, and we use that as a proxy measure, an indication for how much COVID we've got circulating in the community. And I will be monitoring that very closely so that we can continue to track peaks of infection as we progress through this year.
Are you concerned people won't keep to the advice that you've offered of 5 days?
Since we stepped back the drive-through centre, we know that we've had under-testing and under-reporting of cases in the community. What I keep a very close eye on is the hospitalizations resulting from COVID infection, and that's been the driving factor for me. It's the severity of the illness we have. We are very fortunate. We've got a highly vaccinated population, and the waves of infection that we've had in the main haven't been causing severe disease.
What would you say to someone who perhaps has a more vulnerable immune system, perhaps they're undergoing treatment of some sort, and they hear this news and they're worried now that they feel more vulnerable to catching COVID?
Exactly. I do appreciate that for some people this is, still a concerning time, especially if you have a weakened immune system. Our advice remains, please take up offer of vaccines when these are given to you, and please be mindful of the people you come into contact with, and don't be afraid if you feel you want to continue to wear a mask when you're in crowded indoor areas.
We'll get to vaccines in a moment, but before we move on to that point, in the statement issued today, it says members of staff working at the GHA, ERS or care agency who test positive must continue to contact line managers for advice regarding returning to work. So could you explain to us what the policy is for these areas if you test positive? Surely if the advice is for the public to stay away if they test positive, members of staff should not be there if they are positive for COVID.
Exactly. We are strongly advising our staff. We still have a testing programme in place for GHA and ERS staff, and we'll be maintaining that. The advice to contact the line managers is so that we are absolutely aware of why people may be off work, and you're absolutely right, we will not be allowing people to come into work until they've either done the 5 days or then tested negative after that. So I'd like to reassure the public that they won't be treated by staff who are COVID positive in that infectious period.
Now staying with ERS, GBC understands there's been an outbreak at Hillsides. Could you tell us about that? Is that correct? And what's the situation on other ERS sites?
So as expected, we're now having a second peak of infections as we progress through this year. We knew that we were going to have waves of infection as we progress through the year. This is not unexpected. So yes, we've had outbreaks on a number of sites. We'd like to reassure the public they were rapidly identified, and for the vast majority of individuals it's resulted in very mild disease.
You've mentioned the high level of immunisation amongst the community because of the vaccine programme. Could you give us a sense of what take-up for the most recent booster was like?
Yeah, so we launched our sort of autumn-winter booster programme right at the end of last September, and up until the 9th of March we'd had nearly 5,800 people who'd taken up that offer of having a booster vaccine. I'm really, really pleased that the majority of those were in the older age groups, and they're the potentially vulnerable people who would want to protect with vaccine. We're actively considering at the moment when our next booster is going to be offered, because you'll be aware the UK have just announced they're going to offer a booster to over 75s and those who are immunocompromised and those who are living in elderly residential care homes. We're just looking at the practical logistics of whether we could offer the same, and further announcements will be coming soon.
Is the booster currently available at the Health Authority?
Yes, we've still got supplies of the Omicron bivalent booster at the moment.